Okay, so David and Jacqui, can you tell me a little bit about your son Harrison?
Okay. Our son Harrison was diagnosed with a brain tumour in 2010, and we saw a lot of, I guess, symptoms leading up to that to get us to the point of being diagnosed. He was vomiting a lot and was walking with his head tilted to the side, and it took a few different, I guess, strategies to work out what was wrong with him. Like we had to have eye tests and hearing tests and different things before we eventually had a CT scan to work out what the problem was.
And how old was he at that point?
At that point he was 20 months old. And it got to the point where he was very, very sick and was vomiting, and we couldn't keep anything down. So the CT scan revealed his problem, and then we were immediately transferred from Campbelltown Hospital to Children's Hospital at Westmead. And yeah, he had to go through a couple of surgeries quite quickly to relieve the pressure on the brain for him, because the tumour was causing the fluid to build up around his brain. So quite quickly they had to operate on him to do that, and then eventually the removal of the tumour after that. He was in hospital at that stage for about 7 weeks, and then just because he needed to sort of pick back up, and because he was very, very ill, and it took a while to recuperate. And as part of his treatment, then outside of hospital, he underwent radiation therapy at the Westmead Hospital. We had to come in as an outpatient every day for about 6 weeks, early in the morning. And so he had radiation treatment on that particular area. And from there, we just sort of, it was a bit of a wait and see sort of game to see how he would respond to the treatment, and seemed to respond very well. And after having that treatment for 6 weeks or so, and then having an MRI another 6 weeks after that, it seemed to be clear, and we seemed to have what we would consider a normal little boy back again. And even throughout his treatment, he was able to function like a normal toddler. Just playing and eating and doing all the normal things that a little toddler would do. Then probably 6 months after that, nearing the Christmas of 2010, he seemed to have a sore back. He seemed to get upset when we changed his nappy and things, which we thought, oh, that's a sore back, and he had a temperature. And during the initial removal of the tumour, he had a shunt put in, so whenever you get a temperature with a shunt, automatically you think infection. So we came straight back to the hospital, and with the sore back combined with the temperature, and again having more scans, they found the tumour had a new tumour had grown in the spine. So we had that tumour removed, and again more radiation treatment. And again, 6 weeks, a couple of months after that, it seemed to be clear. So our child, I guess, Harrison didn't really look sick. You could just see, that the scars or where he'd had tumours removed and different things. But in terms of he himself, he functioned like a normal toddler. So we just went on our merry little way with life, as you do. We knew throughout this time that the tumours that he had were cancerous, and that this type of cancer is it's not really curable. And we had been lots of discussions with the doctors about looking at quality of life as opposed to quantity of life. So we just sort of did the treatment that we thought was necessary to keep him comfortable and do the best that we could. I myself didn't really consider his death at all until the third time we found more tumours and more cancerous cells in his brain and his spine. And that came when we saw his face droop, and that was probably June 2011. And so that was at the point where we knew that there was nothing else that really could be done. He could have radiation treatment to provide comfort in the remaining months that he had left, and we were given the option of chemotherapy, but the chances of that reducing the tumours or helping in any way were quite minimal, so we decided against that option. That was hard, so then in June, that was the point that we knew that, okay, he only had a few months left to live, and that's when, you know, the palliative care team came on board, and we started that journey from there until the end of his life. Yeah.
From the time Harrison was diagnosed and he was undergoing all these treatments, what was it like for the two of you?
I suppose in some sense that just became the norm. So trips to hospital, where it was, instead of someone would think to go to the doctor or take Panadol, it was just after that initial surgery, it was just pretty much, well, you know, it's 9, 10 o'clock at night, let's just go to the hospital. So there was no hesitation sort of thing of what we had to do and whatever was best for him. So that's pretty much, well, we just took what we had to, and whatever problems came up, we just, whatever information we could get and were told, and we just make our decisions off that. That's all we could sort of pretty much do. So.
What kind of support did you have during that time?
We had a lot of support. Like David said, like for me, when we found out that Harrison had that illness, my mother mode just kicked in, and all I did think about was what I needed to do to care for him, and that meant staying in hospital at weeks on end with him, or whatever that meant. And we had a really good support network which enabled us to do that, because being in hospital for 7 weeks is quite a long time, and having to stay by the bedside every night, it can get pretty draining. So I was fortunate enough that, you know, David and I could swap sleeping some nights, or even my mum could come in and relieve me or David for a little while, or my dad, David's mum. We had a good our family was really supportive in that way, so that we could, I guess, get a bit of relief in that way. And we had we belonged to a church, so we had that whole church group around us as well, and they had a ministry where they were providing meals, so we didn't have to worry about food because people were cooking for us. So that was one less thing that we had to worry about.
So that while we were in hospital, it wasn't like we were getting takeaway every single night.
Yeah, we were getting.
So we had a sense of, I suppose, home cooked meals. So.
And so they were, and people visiting as well. So everybody was really supportive in that way. Yeah, and we just worked out as we went what we needed to do, and everybody was on board. So that was really, really helpful. And I think too, the way that the hospital itself, the process and the procedures of all the people and all the different teams that were involved with, like the social worker and the nurse educator, and we just felt really informed by all of those different people as well as one big team, and that was really helpful because that alleviated any stress that might have been related to waiting for a surgery or waiting for a treatment or starting a new medication or something like that. We were informed and we knew what was happening, and that was really important as well. So.
And when the concept of palliative care was first introduced for Harrison, what did you think?
I don't think I really thought anything. I think I was too much in shock that this is the point we were at, because we knew that Harrison had a brain tumour and that it was terminal, but that was always in the back of my mind. We always lived life like giving him normal life experiences, and he appeared normal. He didn't appear what I would consider a sick child. So when we got to that point where we were told, okay, he's only got a few months to live, I think I was in too much shock to really think anything. And I think like previously when we'd taken the other, the social worker or the other sort of teams on board, we just automatically thought, okay, this is the process, this is what you do. So we'll take the palliative care team on board too. And so initially I don't think I really thought anything. I just thought, okay, that's just what we have to do. And I think I was in too much shock to think anything else.
We had a bit of overload, I think, by that stage of the information and having to make big decisions sort of things. So.
And I think it wasn't until we got into it a bit more and saw what the palliative care team role was, then we thought, okay, well, we've made the right decision. That's good, because this is another person that can give us more information and help us along the way, and give us the confidence to know how to deal with this next stage.
Mm-hmm.
And we saw that as we went along. I didn't think about it at first, I just sort of took it on board, but then we could see as we went along that last part of the journey that, yeah, that was a good decision to have made. Yeah.
Did you know what palliative care was when it was introduced first?
I think for me, palliative care is a group of people that helps people in the last part of their life, and that's all I really knew. I didn't really know in depth what their role was, but I just sort of thought, okay, this is the team that comes on board when the person's dying, basically, and they're in that last stages, and they know they're dying, and yeah, that nothing else can really be done. But I didn't really know what their role was and what that actually meant at first. No.
So after your involvement with palliative care, did your understanding change of what they do?
Yeah, I'd never really considered the whole thing of pain management, like, because with the body shutting down, that there's going to be a great deal of pain. I guess it didn't really cross my mind. So yeah, having to then through talking to the palliative care team, be aware of what pain might look like in Harrison as the stages go on. I think that was probably the big thing for me, knowing what to look for and having the information from the palliative care team to help me to know what to look for, to sort of assess whether Harrison was in pain or wasn't in pain and what level of pain, and then all the medications available to deal with that. It was definitely a big learning curve. Yeah.
David, you talked earlier about you had to make some big decisions. What were some of those decisions?
I think through the course it was, well, there was no, I suppose, the surgeons come up and said we need to do this surgery. It was just, all right, let's just go and do it. Through the post-op, so we had the radiation. That was always, well, that's what they're suggesting, and we got the percentages and the research that they were saying that this is what is best for this type of tumour, because every tumour is different, so what you do for one different for another. And then there was never for chemo. Chemo was never really, they never really considered an option. So when we got the final prognosis, they said we could do it, but then it's like, well, is that option a good thing for him, or is it a good thing for us? That they sort of said that it might reduce, but it would never get rid of. So in the end, it's like, well, do we go down that avenue and try to do everything that we can, but it's not going to cure him and put him in a lot more pain than what would, I suppose, us as parents would want to put him through. So that was, I think that was the big one where we go, well, what are we going to do? So, you know, because it was pretty much chemo or nothing. That was pretty much our...
Just a little bit of radiation for comfort purposes. It wasn't going to cure in any way, but it would make him comfortable because one of the tumours was pressing on his spine. So yeah, that was sort of the option, chemo or not chemo. And I think we just got to the point where it was, well, it came back to that issue that was raised earlier of quality of life versus quantity of life. And either way, he was going to pass away from this illness. That there's not a known cure for this particular tumour. So we went with quality of life and decided against chemotherapy because although there are certain cases where chemotherapy might not affect people at all, generally chemotherapy makes people quite sick. And we thought, well, he's already going to be deteriorating and feeling probably quite miserable. Why add an extra burden in terms of chemotherapy when it's not really going to produce any positive results for us, we thought. So that's why we went down that path.
I think pretty much at that stage he'd stopped talking, so he couldn't really communicate with us at all. So,
and I mean, how much language does a less than 3-year-old have anyway? But whatever language he had was taken, and movement was limited, and so we just thought, well, you know, that's enough. That's enough to deal with without feeling sick on top of that with chemotherapy. So we opted for quality of life of what he had left over quantity.
And what was that period like after you made that decision?
I suppose we made decisions pretty fast. So, I mean, I think it was like a family holiday. We'd always said, oh yeah, we should go away, because I was doing uni at the time, so we had semi-plan around that, but then it was just, well, let's just go.
We took a holiday to Cairns. That was, my brother lives in Cairns, and it's something that we'd always planned to do, and we were thinking, or before we knew the prognosis for Harrison, we were already thinking that July to go on that particular holiday. So that just cemented that for us, because we knew my brother would not be able to come down to Sydney to see him before his passing. So that gave us an opportunity to link up with other family members as well. And I think I still tried to continue as I had before, with as much as possible, giving him life experiences that a normal toddler would have. Like when we went to Cairns, we went to the zoo, and we went to Green Island, and you know, we did things that we would have done if he was well. So we just to expose him to things that he would have done if he wasn't sick, and just continued to do that, and just continued to care for him in the way that he needed to be cared for. Like if we needed to learn new skills to look after him, like administering medications, or we had to learn how to set up a feed pump, because eventually he got to the point where he couldn't swallow food anymore, so he had to have a nasal gastro feeding tube so that he could be fed, and learning how to set that up, and those kind of things, just to look after his care, but still seeing the same people that we would see. Like we went to his childcare centre to visit his friends, and we took him to church to see his friends and at church, and just still keeping things as relatively normal as possible to give him those life experiences, and to show him that even though he probably didn't understand what was happening to him. I mean, he was less than 3 years old when he passed away. He was probably frustrated, confused, and probably miserable because his body wasn't doing what it used to. But just to, show him that, he can still do those things and be involved in those things. And the people that have always been in his life, I guess, still love him, even though he's different. So I guess that's how we sort of handled it.
So you mentioned earlier that you did a lot of caring for Harrison at home, I guess after his referral to palliative care?
Yes.
Did you have any teams from the hospital visit at home to help with that, or was it sort of solely up to you guys?
We had a lot of the teams from the hospital came out. We had like a big meeting at our house. We had the social worker, physiotherapy, occupational therapy, palliative care, nurse educator. I'm just trying to think. But there was all of the teams that we'd had contact with at the hospital, a representative of each of them came out to our house, and we had a big meeting so that we could look at the house and see what needed to be done to help with Harrison's care and make sure that he was comfortable whilst at home, and also to give us confidence and make us feel comfortable that we could care for him within the home during these end times. Just little things like having a hammock type thing in the bath so that he could be bathed because his movement was limited. Chocking up his bed so that he was sort of on a bit of a lean, showing us how to use the feeding pump and suction to remove saliva because he couldn't swallow properly, and so remove the saliva, and the medications, how to, because some of the medications, you know, had to be prepared because they might have been in tablet form or
ampules or
liquid, all different forms of medication. So we had everybody coming out and helping with that, so that was really good.
And it was always just a phone call away, sort of, if we had a question, so that was always good. So we weren't sure about this or that, so that was always a good part.
And in part of that planning and preparation, did you have a conversation about where you would want Harrison to pass?
We did have that conversation, and I must say at the point of Harrison's passing we hadn't made a definite decision as to where that could be, because it was suggested it could be at home, it could be at the hospital, or we were also introduced to the Bear Cottage, the Children's Hospice in Manly, and we did manage to get to visit there once, and that was really nice. And actually Harrison didn't want to leave when we had to go home. But unfortunately, we only ever got to go there that one time. We'd planned to go that week that Harrison actually passed. Although we knew Harrison was dying, his passing still felt quite quick for us, and we still, in some ways, weren't really prepared for it. But in hindsight, his symptoms change as the deterioration occurs, and we happened to be in hospital learning to manage a new symptom, or what we thought was going to be learning to manage a new symptom, when Harrison actually passed away. And I think in the end, I think David too was happy that he passed in the hospital. I don't think I really wanted it to happen at home. And we didn't, although we went to Bear Cottage and it was very nice, we didn't have much of a connection with Bear Cottage because we'd only been there that one time. We hadn't built the relationships and the rapport with the people there. So we were kind of, I guess, relieved and felt that the hospital was the right place for Harrison to pass away. And interestingly enough, he passed away in a ward that we wouldn't normally go to. Whenever Harrison was in hospital, he usually was in the CT ward. And when we got to the hospital through emergency that night, there was no space in CT ward for him, so we were in Camperdown ward. And I think ultimately, that was a good thing too, in a way, not being too close to people that we'd had all those relationships and connections with, because I think that would have been more emotional for us. We were in a different ward with different nurses that we didn't really know very well, and I think in a way that might have been better for us. Well, for me personally, I found it better, because when all the nurses came down from CT ward to see us when Harrison had passed, and to see him and see us, that was really hard, emotionally really hard. I think although we didn't really plan it that way, it turning out that way was a blessing for us. I think that was, if you can say it's perfect, the perfect way for it to happen.
And in the days after he passed, what was that like? Do you remember?
Well, I think in one sense, when it happened, it was kind of not the right thing to do, but what do we do? Because he passed at 3 o'clock in the morning, so then we felt that we would like family to come along and say goodbye. But then we go, well, how early do you wake up, people? But then it's up to the individual whether or not they wanted to come out, so we invited people, but if they didn't want to come out, that's their decision, that's fine. But then we were like, well, what's the process we're supposed to go through here? So we sit there in the room with him in the bed like he's asleep, sort of thing, And then family members came in and said goodbye, and then we decided that one of the nurses, which was a good thing at the time, suggested foot and handprints. So then we all did that. And then I think when the final decision was to take him to the morgue, then after that it was kind of, what do we do now?
Before that the nurse suggested that we give him one last hold, one last cuddle. So we did hold him and cuddle him, and we did take photos of that because it's, you know, the last time that we'd ever get to hold him, kind of thing. So we did do that before we took him to the mortuary. But yeah, so I guess it's going to be different for everybody, what they want to do with that and how they feel about that. And like David, we were sitting there quite numb and thinking, what do we do now? Like, do we, even like before he went to the mortuary, it's like, well, when should we take him? Should we go now? Should we sit here longer? It was all a bit, what do you do? And then I guess in the end you just do what feels right and comfortable for yourself. And yeah.
And I think for us it was like, well, once he went there it was like, well, let's just go.
Yeah, we left the hospital, yeah.
And then I think for us it was, I suppose, the drive home, because we went there with him and then he's not coming back. So I suppose not straight away sort of hit you, but it does, because for us, but hospital was like a second home sort of thing. So we'd go there and then we'd just go through the next stage and we'd go back home. So
but I guess we knew that this time we were leaving the hospital and we weren't bringing him home. I felt physically ill. Like, that was how, I guess, my grief and loss manifested itself. I was like, I feel so sick. Yeah, and then the days after that, it was, you just feel numb, like you just don't know what to do and you're wandering around. And I guess in a sense for us, I had more time to do that because Harrison at the time was our only child. I didn't have to get up out of bed and care for another child. I didn't have to get up out of bed and go to a job. I wasn't working permanently at the time because I was, you know, caring for Harrison. So it was kind of like I just stayed in bed and some days cried and some days didn't, and just got up and wandered around the house. Well, we were actually staying with my parents because we just found that was more supportive for us to be, because my parents only live 5 minutes from our house, so we just felt that, yeah, being there with them was a bit easier. So yeah, so I didn't even, like, I was in my parents' house, so I didn't even really have anything to do there. So so the first few days were probably really hard because, yeah, I guess no purpose left now for me, because being a mother was my purpose and that had been taken away when Harrison passed. So the first few days were just really hazy and, yeah, yuck.
And then it was pretty much the eventuality of where do we fit again sort of thing, because say couple and then family, and then family with sick child, now no child.
Back to couple.
Yes. So
yeah. So
was that difficult for the two of you?
I think you really notice, I know it sounds funny, but how much spare time you have when you don't have kids. But what you think you're so busy, you're not busy at all. There's not wasted, but it's time consuming.
It was a bit hard in a sense too, because like I said, we're part of a church and we spend a lot of time with other young people there that have children, and the groups and the activities that we do sometimes revolve around the children. So were we still a part of that group, or are we not a part of that group anymore because we don't have a child to to take to the group. The group was very open and welcoming, don't get me wrong. They still wanted to encourage us to come even though Harrison had passed and everything, and that was really nice and helpful in some ways. Obviously seeing the other children there at times made us upset because it showed us what we were missing out on. But yeah, we just still felt really supported, I guess, by those people. So that was it was good in the end. Yeah, because I guess for us, or for me personally, I sort of tried to get myself to a point. This didn't happen the first few days. This was, weeks, months later. Get myself to a point where we had this beautiful little boy, and he was such a blessing, and so I want to talk about him because we had him. He was here. He was a life, and he was ours. And when you're talking to other people that have children, he's our experience to draw from when other people are talking about their children. Well, we only had Harrison to talk about, so, well, hey, why not? He's a blessing. And some people found that a little bit confronting and hard to deal with. Other people were fine with it. We sort of come across that sort of, some people didn't want to talk about him at all, like family members. Some friends initially didn't want to talk about Harrison at all, and others were comfortable with it. We're at a point now where most of their family members, if we strike up a conversation about Harrison, they're happy to talk about him now, but initially, it was too hard. It was in the too hard basket for them. But overall, I think we've been pretty fortunate with the people around us and how they've responded to what's happened, and they've been really supportive of us, so we're lucky.
But I think because we were just a couple, I think it only seemed to not change, but as in when my wife was pregnant again, the conversation hits up, how many kids do you have? So then it's like, well,
to people that don't know you.
Don't know you. So do you sort of say you had a child that passed away, or do you just make it easier or not as confronting, just to let it go sort of thing? Because that was also the other, do you tell someone, and when do you feel comfortable enough to tell them? Because when you have this conversation with someone, it pretty much ends the conversation. So that was, I think, while we were a couple after, that didn't seem to come up in the conversations that we might have, but as soon as my wife was pregnant, that seemed to be a new thing that we had to deal with.
And I was sort of confronting it almost on a daily basis, because at the time, I'm a childcare worker, and at the time I was doing casual work. So I was entering new centres, different centres every day that I hadn't worked in before, people that didn't know me. And obviously you're working in childcare, what do you talk about your children? So, and in the end, I just decided I'm happy and comfortable to say that I had a son and his name was Harrison, and he's passed away, but this is what he was like. And I guess most people were like, oh, sorry, but they still were happy to talk about it. Some people wanted more information than others, but I just found myself saying, well, no, I have a son, his name's Harrison, and I'm going to talk about him regardless of this experience that's happened. And if people don't like that, too bad. That's their problem, it's not my problem. I'm comfortable with it, and so, but it turned out okay in the end, so yeah.
Was it a difficult decision to have another baby?
I think the decision to have another one, I think in some sense we did put it off while Harrison was sick, because we didn't want that, whether or not that might have affected the birth.
And even after Harrison had passed, I think we took a while before we decided to fall pregnant again, because the mind does silly things, and I sort of thought in my mind, if I have another child now, it would be like I'm substituting Harrison with this other child, and I didn't want that to be the case. I didn't want to feel like that.
Yeah.
So we waited a while, and I just had to convince myself, well, no, I believe I'm meant to be a mother. I'm meant to have children, and the one that I had was taken, so the only way to be a mother is to have more. And this baby will not be a substitute for Harrison. It'll be a sibling for Harrison. I needed to really convince myself of that. And I guess the crunch came was, you know, biologically I'm getting to the older end of having children, and so I just thought, well, no, if we're going to do it, we have to bite the bullet and do it, and we did, and never turned back, and wouldn't change a thing. Yeah, so it was a little bit hard, but it was, at the same time, I knew that we would eventually do it. We just had to give ourselves a little bit of time before we did that. Went down that path.
I think in some sense also too as to how we are going to bring Harrison into well, our son's name is Jonathan, but how we're going to bring Harrison into the relationship or experiences still.
Yeah. For
Jonathan.
For Jonathan
yeah. To know him.
Yeah.
I mean, it will come up because there's photos all over the house of Harrison, and they're not going anywhere. So we definitely have a plan to let Jonathan know that he had an older brother and his name was Harrison, and to tell him about that brother. So that'll be a new thing again that we have to learn along the way, and experience of how to do that. At the moment he's only 7 weeks old, so it's a bit hard, but as he gets older, I'm sure there'll be questions and things that we'll have to sort of fill him in on, and probably issues that may even arise from that for him, I guess, along the way. But that's just the path of our lives, so we'll just deal with it when it comes up. The interesting thing I think will be with having another child is now how we will react in certain situations with him, having experienced what we experienced with Harrison. Like, you know, when he gets sick, are we going to be, you know, the overprotective, crazy parents, or, you know, how will we react to different things with him? But that remains to be seen. Yeah.
And so what's it like for the two of you, how as individuals you've experienced grief, and then as a couple as well?
Well, I wouldn't say polar opposites, but I can admit it, I'm the blubberer. So, and I mean, I think at the time I needed something to keep myself busy, so I was in my final year of university, so that kept my mind busy, so I think I needed that at the time. But I could say a year later, so August 2012, when it was the year that did hit me, I suppose, a bit harder. I don't know why, but it just did. And there's nothing in particular that would set me off for my grief. I can be watching TV and I see something, or I can go to the movies and I see something. So there is, you go to the shops and you see your family. So there's nothing in particular that sort of sets me off. But then I would have my little cry, and then I'm sort of off again, sort of thing. But my wife has a different.
Yeah, initially I cried a fair bit because I didn't know what else to do anyway. Like, I had nothing else to fill. I didn't have university or anything to go back to take my mind off things and fill in my days. And then I just found that it gradually it tapered off to, I'd only get upset when something else was already upsetting me, like something was frustrating me or I got upset about something. I'd start crying, and then all the emotions of what happened with Harrison would come into that. And that happened for a little while. but more so I just, like, very occasionally, but sometimes something will set me off. I won't cry, but I felt that physical illness that I felt the day that I was leaving the hospital when Harrison had passed away. So that's sort of how, it looks like for me. Just little things can set me off. But I don't know, it sounds really bad, but I guess I've got to a point where I see Harrison as a blessing, and so I'm able to talk about him and do that comfortably without feeling... I still feel a loss. There was still a hole, and I had to find a whole new purpose in life again, because he was my purpose. So that was hard, because it was like, oh, do I go back to childcare after this? And then I thought, I don't know how to do anything else. It was literally, I don't know how to do anything else. I don't know what to do. All I know how to do is care for children. It's all I've ever done. Okay, I'm going to have to go back. And it wasn't as hard as I thought it was going to be. But yeah, it's still pretty hard, because some days you don't want to have that conversation, especially when I was pregnant, like we said before. Some days you don't want to have that conversation. Oh yeah, I did have a child, blah, blah, but he passed away. But you get through that and come out the other side. But
I think also that we sort of found that whatever way you grieve is your way, and that's fine.
Yeah.
So
I mean, we're chalk and cheese when it comes to grieving, and
that's
we accept that that's the way it is, and accept others' grief for what it is, and it's very important. I think that you do realise that everybody does grieve differently, because if we didn't realise and accept that, we could end up in arguments or all sorts. So, but we managed.
But I think one of the challenges was that we were managing our grief, but then family or friends would be dealing it differently, and sometimes we felt as if they were trying to whether or not they were doing it differently than us, or
like we felt like we had to take responsibility for their grief in a way, and because they weren't necessarily dealing with it that well, and then the way they dealt with it sort of played on our relationships with each other, and then we just had to say to ourselves, well, no, their grief is not our responsibility. We're dealing with enough as it is. They need to work out their way of dealing with things. That was more initially, I think. I think things are a lot better now, improved now. Yeah. So, but yeah.
How have you changed from this experience?
I guess I'd say I've got a stronger character. Can deal with things and handle things pretty well, a lot better than I used to. And I think, really just like being grateful and thankful for what you have, and being content with what you have, because it can be taken away in an instant. And so just being happy and grateful for everything that you have, and I think that's really what I've found to be a valuable lesson. Very important.
Yeah, I think we have changed because of this, because we changed because of having Harrison, so this will have affected us, and in some sense I suppose we've noticed changes, but then there might be changes that we won't take effect until later on in life, or how we raise Jonathan, or so it's changed us, but it's hard to say in some sense what it might have done to us, because of these experiences that changed us.
I think it will change my parenting style a little bit, because one of the big things that I dealt with after Harrison's passing was feeling guilty, because if he had done something naughty or something wrong, I hadn't managed his behaviour as well as maybe I thought I should have, and I felt guilty about that. So whether I did or didn't, manage his behaviour properly or not, and whether I did the right thing by him in that way or not, I don't know. So when it gets to sort of learning to manage Jonathan's behaviour when he gets older, whether I'll use the same strategies I did with Harrison, or whether I'll sort of think, did I really do the right thing by Harrison with those things, and should I change to, for Jonathan? And that was a guilt thing for me. I really felt guilty about that after his passing, that, I hadn't treated him fairly with behaviour management sort of things. So I'll see what happens when I get to that point again. But yeah.
I think in a whole sense it just sort of made us realise what really was important in life. For us,
definitely.
Sort of thing.
Have you changed as a couple?
I think so.
I think we communicate a lot more.
Yeah, I was just about to say the same thing. I think we communicate more and more effectively.
Yes.
Yeah, as well. Not just more, but yeah.
Because I think when we first started after his death, we really had to communicate, because I was handling it differently than my wife.
Yeah.
But then there was no sort of, well, she's not doing it the right way. But it was more of, we had to communicate to know where we each were, because some days were good, some days weren't so good.
Yeah. Yeah, and even now, I don't presume to think that I can read what he's thinking or feeling when something happens and he does, start to get upset or whatever. I still think, in my mind I might know, but I still ask, just to see, why are you feeling like this? What happened? What did you see or what did you hear that made you feel this way? And yeah, I think definitely that's one thing that has, definitely changed for us. Better communication skills. Yeah.
Well, then, and a sense that, during the process we had a sense, we just had to learn new things and sort of jump on board, and like medicines, we had to figure out all these medicines. There were that many medicines, we had to figure out they had to be regimental sort of thing, and things that we would feel uncomfortable doing. So, say the suction, I had to sort of physically hold him down to do it, because he didn't like it. But
so I guess that's learning. We learn, I guess, then in that sense to work well as a team.
Yes.
Each of us had our different things that we did in terms of Harrison's care. And
that we felt more comfortable doing. So.
Comfortable and confident, and working as a team.
Yes.
Yeah.
Is there any advice that you would give to families who might be considering involving palliative care with their child?
I'd say do it.
Do it.
Because without the palliative care team, we wouldn't have gained that confidence that we had to have in learning and doing new things to care for Harrison. We wouldn't have known, had the confidence to administer the medications, and to do all those things that we needed to do to care for Harrison. That was part of too what going to Bear Cottage was all about as well. That was suggested for us to do. To get that confidence of administering the medications, and then if we wanted respite from that, then the nurses could do it for us while we were still gaining the confidence, if that makes sense. Yeah. But no, I think the information from the palliative care team was really important for helping us to have the confidence to do that, and also knowing that if we did have questions about what was happening to Harrison throughout the stages of his deterioration and passing, we could ring up and say, what's happening here? These are the symptoms I'm seeing. What does this tell me, kind of thing. And then having the information, what to do now that this is happening to Harrison. I think, I don't think I could have gotten through that experience without the palliative care team. Or if I did, I would have been a blubbering mess, an absolute mess, because I wouldn't have had any confidence in knowing what to do and information on what's happening to my child, because the body shuts down in certain stages, what those symptoms look like. I wouldn't have known that only for palliative care team and the fact that David read it in a book and he told me. But I can't read and do that kind of thing at that particular time. Having to read a book for me was like, no. I just need someone to tell me.
Yeah.
But see, I found comfort in doing that because that's just me. I felt
so different people, different strategies, but
then I think also, even though the sense of the medicines that you as a parent, you still know your child, so there were certain medicines that were suggested to us that when we administered them, they didn't really they weren't the best for him, and we considered, well, we as parents are still involved, so how about is this an alternative? So can we not give him this because it has this effect? Where he would be more lethargic and sort of less, more out of it. So,
because we were the ones seeing him and seeing what the effects of the medicines were doing to him. So then we could go back to the palliative care team and say, oh, well, this is the effect this medication has had. Is there any different medication we can use to improve that? And we could get that information from the palliative care team. If we didn't have them involved, we wouldn't know where to go and what to do. So no, definitely, information is really important, and the confidence to know what to do is really important. I think the palliative care team provided both of those for us. Yeah.
Is there anything that we haven't talked about that you would like families to know, either in the palliative stage or in the bereavement stage? It's okay if there's not.
I suppose in some sense there is no wrong or right way to grieve. It's just your way, and whether or not it happens straight away, whether or not it happens down the track, it's just, that's your journey. So I mean, and don't get a sense of being frustrated that someone else isn't doing it your way, or you feel as if,
or don't feel bad because you're not doing it the way they are. And I don't know yet, but I don't know that grief ever ends once you've lost a child. I think it'll look different in different stages, but I think it'll be with you for the rest of your life.
Okay, we might stop there. Thank you very much.
Thank you.